Today we are going to discuss hypoxia and hypertension, two different topics but in the same lecture. What is the definition of hypoxia? Hypoxia is oxygen deficiency at the tissue level. So, when the tissue does not get enough oxygen, tissue becomes hypoxic. What is anoxia? It is total lack of oxygen at the tissue level. Hypoxia at least has some amount of oxygen at the tissue level. What are the types of hypoxia? There are basically four types: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. What is hypoxic hypoxia? It is basically a reduced PO2 at the arterial level. Reduced oxygen in inspired air, like in high altitude or in a closed room. Decreased pulmonary ventilation because of asthma, respiratory muscle paralysis, emphysema, any type of airway obstruction, and respiratory center depression in the brain. Number 3 is defective gas exchange and oxygen transfer, for example, in pulmonary edema. So, we had spoken about V and Q, ventilation and perfusion. There is a mismatch in the ventilation and perfusion because the brain is not stimulating the respiratory center to work. Defective ventilation perfusion ratio, same thing, VQ ratio, where uneven alveolar ventilation, like in asthma, emphysema, pulmonary fibrosis, pneumothorax, and congestive cardiac failure. Non-uniform pulmonary blood flow, where the pulmonary blood flow is sometimes oxygenated and sometimes deoxygenated, as in anatomical shunt, like in tetralogy of Fallows, or in any right to left shunt. What are the characters of hypoxic hypoxia? Number 1 is low arterial PO2, low percentage saturation of hemoglobin. If you take individual hemoglobin and see their percentage saturation, it is lower. Lower content of O2 in the lungs, and lower arteriovenous PO2 difference. That is, the arterial PO2 and the venous PO2 are almost the same. There should be a huge gap. Arterial PO2 should be very high and venous PO2 should be comparatively lower, but here it is the same. We had been talking about right to left shunt of the hemoglobin. Hemoglobin contains a chemical called 2,3-DPG, 2,3-diphosphoglycerate. So, a left shunt is due to hypothermia, decrease in 2,3-DPG, and when there is a acidosis, decreased hydrogen, or in a carbon monoxide poisoning. So, what happens to in the left shift? The oxygen carrying capacity is not compromised. It is the oxygen delivery which becomes less. Similarly, the right shift of the hemoglobin curve is due to increased temperature, increase in 2,3-DPG, and in alkalosis. So, there is a right shift of the oxyhemoglobin curve. So, the delivery is higher. Whatever the oxygen content, it delivers to the tissue. What is the pathophysiology of hypoxic hypoxia? It acts via the peripheral chemoreceptor, stimulates respiration to increase oxygen PO2, but also washes out the CO2. Resultant is a low carbon dioxide. The shift of oxygen hemoglobin dissociation curve to the left, so there is less oxygen delivery to the tissue. Thus, in totality, tissue hypoxia occurs. So, we have already said that there is a metabolic acidosis because of the PO2 being low, CO2 being high, there is a metabolic acidosis. So, this hypoxia stimulates the respiratory center. What happens? Patients start hyperventilating, leading to compensatory metabolic alkalosis, which results in an alkaline urine. This resultant is an increase in blood pressure. Hemoglobin concentration in the blood increases because of polycythemia. The polycythemia occurs because more hemoglobin is produced in hypoxia, so that whatever little oxygen it is taking can be delivered to the tissue. These are all compensatory mechanism of the body. There is an increase in 2,3-DPG in RBC. Now coming to anemic hypoxia. This is due to reduced hemoglobin carrying the oxygen. The hemoglobin in the blood is low. Can be due to anemia of a number of causes. Acute hemorrhage, patient starts bleeding. Abnormal hemoglobin, like in methemoglobin, where normally the iron inside the hemoglobin is ferric. Instead, if it turns to ferrous form, there is methemoglobinemia, where the oxygen carrying capacity of the hemoglobin decreases. There is HbS, the sickle cell disease, where there is a sickling of the hemoglobin, the red blood cell, which occurs due to difference in the acidity and temperature. And carbon monoxide poisoning leading to carboxyhemoglobin. Carboxyhemoglobin, carbon monoxide displaces the oxygen from the heme moiety so that the oxygen cannot enter into the hemoglobin. What is the pathophysiology of anemic hypoxia? Number 1 is iron deficiency in food. Number 2 is infants who are fed with cow's milk, which is very calcium rich. This calcium gets absorbed into the body and leads to a reflex anemia. Achlorhydria of any cause may be due to a disease process or may be due to some drugs which lower the hydrogen ion inside the stomach. Starch and clay eating. Some people have the tendency of eating starch and clay. This is called, eating clay is called pica, and this is a peculiar phenomena where people lavishly eat clay. Surgical removal of a proximal small intestine. Proximal small intestine removal can also lead to anemia. Excessive bleeding, as in menorrhagia, piles, or in an accident. And hemoglobinuria, when blood is passed through the urine in certain conditions. Pulmonary hemosiderosis also is a factor which causes anemic hypoxia. What are the compensatory changes? the circulation becomes hyperdynamic, that is, increase in cardiac output and increase in heart rate. There is increased hemodynamic changes in the body, so there is rapid cycling of the blood. The blood which used to go 72 times a minute will go 140 times a minute. Increase erythropoiesis. So the production of erythropoietin through erythropoietin of red blood cell increases. What is stagnant hypoxia? This is decreased or sluggish blood flow in the system. Can be caused by congestive cardiac failure, any other circulatory failure as in huge blood loss, hemorrhage, shock, and any type of venous obstruction where the venous return to the heart is blocked or decreased. So the cardiac output also decreases and patient goes into a shock. Histotoxic hypoxia is a condition due to certain drugs. You all know about cyanide poisoning. Cyanide poisoning causes histotoxic hypoxia by the cytochrome oxidase enzyme blocking. Acute vitamin D deficiency, as in beriberi, can lead to histotoxic hypoxia. And of course, hydrogen sulfide poisoning can also lead to histotoxic hypoxia. What are the effects of hypoxia in the respiratory system? Except for anemic hypoxia, others stimulate peripheral chemoreceptors, thus increasing the respiration in frequency and in volume. Cardiovascular system, there is increase in blood pressure and heart rate. Anorexia, nausea and vomiting occurs in hypoxia. These are all reflex mechanisms. In central nervous system, depressed mental activity occurs because the blood is inside the brain is less saturated in oxygen. So the brain working gets decreased. So leading to impaired judgment, drowsiness, disorientation, headache, and in extreme case, coma and death. In the musculoskeletal system, there is reduced activity of the muscles because of lack of oxygen. The resultant of hypoxia is also hypercapnia. When the oxygen is not getting into the blood, into the tissue, the carbon dioxide is also not being removed simultaneously. So there is an excessive accumulation of carbon dioxide inside the body fluid. This is always usually associated with hypoxia. Coming to the second topic, which is hypotension. It has nothing much to do except for infringes with hypoxia. By definition, hypotension is a decrease in systemic blood pressure below acceptable low values. Acceptable low values is the term. Some people survive at a very low blood pressure smoothly. So there is a benchmark of what should be the lower level of blood pressure below which we can cause hypotension. This is a statistical data. While there is not an accepted standard hypotensive value, pressure less than 90 by 60 millimeter mercury is recognized as hypotensive. As you know, blood pressure equals to cardiac output into total peripheral resistance. So hypotension occurs if there is a decrease in cardiac output and or decrease in total peripheral resistance. Mean arterial pressure is very important in a living individual. The mean arterial pressure is an average blood pressure over the course of one cardiac cycle. It is calculated as it is equal to 2/3 of diastolic pressure plus 1/3 of systolic pressure. The mean arterial pressure should be kept constant between 90 and 60 millimeter mercury so that we can say the patient is not hypotensive. Again, I am saying this is a very statistical data. Some patients can have low blood pressure and survive very well. What is the etiology of hypertension? There are diseases and there are drugs. In diseases, it can be severe hemorrhage, any cardiac disease leading to cardiac failure, neurologic disease, endocrine disease, dehydration. If the patient is dehydrated, of course, the blood volume decreases, and when the blood volume decreases, there is hypotension, as in heat stroke, and of course in anaphylaxis, allergy. What are the drugs which cause hypertension? The antihypertensive, of course, diuretics, anti-angina drugs, vasodilator drugs, antiarrhythmic drugs, and antidepressant drugs. So, if we put it into a chart, we can see that arrhythmia, which consists of bradycardia, tachycardia, or fibrillation, causes hypertension. Structural diseases like the valvular disease in the heart, ischemic heart disease, pericardial disease, cardiac tamponade, where between the heart and its covering there is blood or fluid accumulation which does not let the heart expand and contract to its fullest exchange. Congenital diseases like obstructive cardiomyopathy, dilated cardiomyopathy, or in primary pulmonary hypertension. These are all structural diseases. Hypovolemia, as in hemorrhage, diarrhea, dehydration, orthostatic volume shift. We will talk about orthostatic volume shift, but this can be due to a disease process or it can be due to a drug like diuretics. Systemic vasodilatation, as in sepsis, anaphylaxis, neurogenic causes, autonomic dysfunction, we are going to talk about it, and certain drugs. Obstructive cause of hypertension is pulmonary embolism. So, you must keep this in mind: arrhythmias, structural diseases, hypovolemia, systemic vasodilatation, and obstruction. These are the main causes of hypertension. Now, coming to the cardiac causes. What we do is treat the cause. There is reduced cardiac output, hypovolemia, blood volume redistribution into third space. When there is surgery, what happens is there is a redistribution of fluid from the primary to the secondary to the third space. Primary space is the blood vessel. Secondary space is the peripheral capillaries and the tissue. And the third space is the space where it is an useless space, where if the fluid accumulates, as in edema, this fluid does not serve any good purpose, it only serves a bad purpose. So, blood volume redistribution also causes hypertension. Reduced systemic vascular resistance. There can be a number of causes of reduced systemic vascular resistance. Vascular obstruction, as we had already spoken about in pulmonary embolism. Coarctation of aorta, where the aorta is constricted and the blood cannot pass through the aorta to the periphery. Renovascular diseases, the renal vessels and the kidney, they regulate the hemodynamics of the body also. So, in renovascular diseases, this is lost. And pregnancy, of course, is a physiological process where there can be hypotension because of redistribution of blood and because of the gravid uterus. What are the neurologic causes? And what do? We treat the symptoms. Orthostatic hypotension. What is orthostatic hypotension? This is a neurogenic orthostatic hypotension is a condition in which the autonomic nervous system, which controls the autonomic function of the body, loses the ability to properly regulate blood pressure. So, the autonomic nervous system has a huge role to play in peripheral vascular resistance. When the autonomic nervous system fails, this peripheral vascular resistance is let loose. So, what happens? When from the lying down, someone gets up, the autonomic nervous system immediately comes into play and constricts some blood vessels. And when the patient stands up from sitting, again the same thing occurs. When the autonomic nervous system fails, what happens? There is pulling of the blood in the lower part of the body, leading to decreased venous return and decreased cardiac output. Endocrine causes. They can be due to Addison's disease, hypothyroidism, in case of diabetic neuropathy where the autonomic nervous system is damaged, and Cushing's disease. These are the causes of endocrine causes of hypotension. Here what you do is you treat the cause. There are a number of antihypertensives which cause hypotension. There are the centrally acting, the sympathoplegic drugs like methyl dopa, which is used in pregnancy with high blood pressure, or clonidine. Adrenoceptor antagonists. They can be alpha adrenoceptor blockers like prazosin, which is usually used in benign prostatic hypertrophy. It is an alpha blocker which is used not in vasodilatation but in benign prostatic hypertrophy. What are the beta adrenergic receptor blockers which we use regularly as an antihypertensive? They can be cardioselective like atenolol, metoprolol, or non-selective like propranolol, nadolol. There can be alpha plus beta blockers like labetalol and carvedilol. These are all antihypertensive agents which are used by the physicians. There are angiotensin inhibitors also. These antihypertensives are regularly used. There can be an angiotensin converting enzyme inhibitor like captopril and lisinopril, or there can be an angiotensin receptor blocker like losartan and telmisartan. There can be calcium channel blockers like nifedipine and amlodipine, and thiazide diuretics. Vasodilators which we use for instant blood pressure control to decrease the blood pressure is to decrease the blood pressure is sodium nitroprusside. This immediately decreases the blood pressure. So, we have seen that there are certain diseases or certain drugs which are the causative mechanism of hypertension, which is a serious phenomena in the body. Now, students, I'm again telling you, if you have any query regarding any of my lectures, feel free to write to the relative authority in email. They are going to forward me the mail and I am going to answer all your questions. Thank you.